The Navajo Nation adding 82 cases and 2 more deaths as COVID-19 continues to spread at the highest rate in the country. Tonight, health officials reporting more than 4,100 cases overall and 144 total deaths. Nearly 1 in 4 of those cases happening in the Chinle area. All of this comes as the Navajo Nation president, Jonathan Nez, announces a plan for $600 million the nation is getting from the Federal CARES Act. And part of that plan will be to help stop major outbreaks in the future. ABC 15's Cameron Polam breaking down where that money is going and why.
There are now more positive cases of coronavirus per capita on the Navajo Nation than any other state in the U.S. As the desert-dwelling community continues strict stay-at-home orders, plans to prevent a similar outbreak in the future are now underway.
30 to 40% of our citizens don't have running water. Multiple generations of family members live under one roof. We have the poorest, as you know, broadband, telecommunication, high-speed internet on the Navajo Nation to get information out.
Potentially grave issues when navigating a pandemic. That's why they're now planning to spend millions in federal funds on upgrades.
We want to be able to use some of this CARES Act funding to get water infrastructure, electricity, as well to our Navajo people.
Building water infrastructure would ensure more have access to proper hygiene, electricity, and increased internet service to make sure critical information is reaching all those that need it throughout the remote nation.
Some of our most vulnerable population have medicine that need to be refrigerated. And if you don't have electricity, there's no refrigeration.
He says while positive tests now total more than 4,000, more than 900 have since recovered. Many still recovering will soon be transferred to the now open and staffed recovery facilities built last month in Shiprock, Chinle, and Gallup.
We can free up hospital beds. We can transfer some of those that are in the beds right now to these step-down clinics.
There are 150 beds across those 3 sites. They hope to keep patients isolated there to prevent them from spreading the virus to family members if they were to return home. While the people of Navajo Nation focus on the challenges they face now, it's clear they're also looking ahead with future generations depending on what they do next. I'm Cameron Polam, ABC 15 Arizona.
It's so important to remember the Navajo Nation is sovereign, so it has to navigate relationships with state and federal governments to get the help they need. Wendy Smith-Reeve, ABC 15 analyst and former director of emergency management, explaining how that dynamic then plays a role in this global pandemic.
Understanding that incident management and that command and control structure is at the invitation of and at the direction of the Navajo Nation leaders. So respecting that understanding and asking, what do you need? What can we provide? To give somebody something that they don't need creates an issue. And so we don't want to compound any issues for any of our neighbors.
She also calls the Navajo Nation's decision to shut down a bold move and a move the nation's neighbors, including Arizona, should respect.
They're going to basically shut the doors within their borders for a weekend. We all need to be very respectful of that. And hopefully what they're going to see is a significant decline in cases and deaths on the Navajo Nation.
Wendy also applauds the grassroots efforts from people here in the valley to bring food and supplies to the tribe.